Hello, Captain Cadre. We are so excited that you have come to this amazing presentation by these amazing presenters. Mary Rettenhouse is one of our executive leaders of our SELPA Content Lead Autism and a leader of Captain. She's also an autism clinical specialist at Alta California Regional Center. And her colleague, Amy McCreary, is a clinical services manager at the Alta California Regional Center. They have presented for us previously, and we're excited to have them back for this virtual presentation about prompting for older individuals, transition age, adult learners with autism and/or intellectual disability or developmental disability. So without further ado, I'm going to let your presenters, they say they have the entire hour and a half planned for you to learn all kinds of stuff and see all kinds of videos, and I'm going to let them take it away. Thank you, guys. Right.
Mary, we're seeing your like a black line on the top. All right, there we go. All right, technology issue fixed. Okay, hi everybody. Thanks for taking the time out of your day. We recognize you're busy, and the fact that you see this as something worth spending your time on really is meaningful to us. And you know, Mary and the group of people that put this together, we put a lot of effort and thought into it, so we're excited to share. So without further ado, we're going to continue on talking about the evidence-based practice of prompting. It is established as an evidence-based practice through the National Clearinghouse of Autism Evidence and Practice. And kind of like kids, you're not supposed to have your favorite, but this one is one of mine. All right, so the goal for the training today is to really take a deep dive into looking at what prompting is as a teaching strategy, and what are the components of prompting that are going to make you successful in its use and implementation. We're going to go over 3 different prompting procedures and try to give examples of each of those different types of prompting procedures, and try to give you a tool set or a little bit of a process and lens to look through on how do I determine which strategies I should be using for promoting prompting within learning opportunities. And then finally, just like everything we do, this is a science. We're going to talk about data collection with our prompting procedure so that we can make sure that the prompts that we're using are working, and that the prompts that we're using aren't something that somebody's becoming dependent on as a learner. So when we look at what prompting is, it really is just any help that you give to a person to do a task or to complete an action. And usually prompts are delivered between instruction and response. So once an instruction has been delivered, once a learning opportunity has been created, it's taking that opportunity between when you have delivered instruction or an SD has been given and when somebody responds to promote increased independence and to promote them being able to do the action correctly. We want to reduce incorrect responding. And then so that's kind of the nit and grit as to why. And then oftentimes we look at prompting as not just a standalone strategy for teaching. We pair it with other strategies to kind of enhance that teaching opportunity. And so here's some examples that you may commonly see in the school setting, and expanding outside the school setting into, you know, those transitional age youth, or if you're working with adults moving towards independence. So in a school setting, you may see drawings for a person to trace when we're learning how to write letters. So we're all familiar with the one in the top right-hand corner, right, where the letter gets a little more progressively deleted when we're learning how to write that. For somebody learning how to sweep, maybe we're pointing out areas or debris on the ground that they have forgotten or missed. Or whenever we're making a sandwich or brushing our teeth, maybe it's providing a little bit of that hand over hand guidance or a little bit of support with your hand to get them to coach through the physical parts of that activity. And so, as mentioned, this is an evidence-based practice. There's research to support that it is positive in the use of creating independence. And for age groups, we're looking at early childhood through young adulthood. And just because the clearinghouse review of data kind of caps out at the young adulthood, it doesn't necessarily mean that this can't be effective for adults that are older. It's just kind of the narrow window of research that was looked at for this specifically. And then we're looking at domains. I mean, we can use prompting for academic, for behavior, for supporting communication, those social and leisure skills, and even adaptive living skills. And so this is just that screenshot from the National Clearinghouse on Autism and Evidence Practices that kind of gives you the quick glance rundown, right? So on the left-hand side, you have all of your outcome areas. So kind of those domains of teaching we look at: adaptive skills, communication, cognitive, social. And then across the top is where we have our age domains, where when the meta-analysis of research was done, the research indicated studies that had support and evidence for those age ranges within each of those outcome areas. Okay, so this is just kind of reiterating, right, that really prompting can be used to address most developmental domains or teaching domains. And what's really nice to think about prompting is not just for the use of teaching strategies, but also for the use of generalizing strategies out into other environments, with other people, with different materials or stimuli, if that's something that an individual has difficulties with. And so our settings, what's nice is prompting can be taken on the road, right? Because there's so many different forms of prompts that we can use whenever we're promoting increased independence with learners. So we can use this in a home setting, in a classroom setting. It is good for adult learning environments, workplace, and community. And I think what is nice to highlight about prompting is it doesn't have to be ostracizing, right? We all take prompts from the environment, from visual cues, from other people, in social situations all the time. So it's not like we're saying, oh, because you are impacted by your disability, you need prompting. It's nice that it is really something that everybody accesses as a way to get through their day. And so here's an example that we're just going to kind of walk through. So in the video, you're going to see we've got two ladies here. We've got Emily on the left, who's wearing the maroon sweater. We've got Erin on the right, who's in the blazer. And Erin is taking Emily to the regional center to visit her service coordinator and have a meeting. And as they approach, there is a sign on the door saying that masks are currently required. And you'll see Erin is going to take her mask out of her pocket and place it on her face. And we're going to kind of watch this play out and see if that prompt, that visual prompt on the door and the social cue of Erin putting on her mask is enough to support Emily and following through with that task independently. Okay, so before we get started and kind of deep diving into that video a little bit, when we're thinking about prompting, we want to make sure that we've kind of thought things through, right? Just like with any of the other teaching strategies that we employ to assist people with gaining more independence or increasing their skill base, we always want to know what is the identified target behavior or skill that we're working, right? Because we can't support somebody adequately if we don't really know what we're trying to do with them. We want to collect baseline data through direct observation to see how much are they doing? Are they able to do any of this? Are there precursor skills or other foundational skills that we need to look at before we're targeting this new skill? And then we want to establish a goal or an outcome that's going to clearly state what what behavior is going to occur, what the target skill is, and how and when we're going to use this skill so that we can measure the effectiveness of our teaching strategies, right? And if we haven't done those things yet to kind of establish that foundation for learning and for teaching, then you definitely want to work with the program behavior specialist, or refer to affirm modules or another professional within your cohort of support to kind of really break down those details. Okay, so taking all of that into consideration, going back to that video of Emily and Aaron walking into the regional center, the first thing we're asking ourselves is, have we determined a skill that we want to teach and target? Right, and so in this case, yeah, we want to work on Emily being able to put on her mask before she walks into a public place, because not so long ago that was required. And then we're going to collect baseline data through observation. So have we done that? In this situation, we had an opportunity. We observed that Emily did not put on her mask, even when the environmental cue and modeling was provided. And have we established a specific goal? So at this point in time within the video, there wasn't a specific goal established, but after this interaction at the regional center, it may be something that Emily's team of support, circle of support, want to come back and have a conversation with her about to see if that's something we want to target for learning. Okay, so when we're talking about prompting, it's not just a single thing. I think I mentioned, right? There's prompts all around us in our environment. And so prompts can really be categorized into 5 different types. We've got physical prompting, you've got model prompting, gesture, visual, and verbal. And so we'll get into a little more detail about each of these. So the first one that we're looking at is physical prompts. And so a physical prompt is when we're using physical assistance to help somebody complete a task, right? I think in school settings and with young learners, we are always, it becomes, I think, more, I just lost my light, apologies. It seems very natural, right, to use a physical prompt with a child, to hand over hand. And where even with adults and transitional age learners, a physical prompt might be necessary or warranted or even welcomed, we also want to proceed cautiously with these older learners, because, maybe they don't want you in their space, or if you're supporting them in a school setting, it may socially set them aside from their peers if they've got a paraprofessional or a behavior consultant with them, hand over handing, when none of the other kids in the lunchroom are getting that level of support. So it's not always what is going to be the easiest prompt to deliver or what is the fastest prompt that's going to get this task done. It's taking into account what is the most appropriate, not only for the activity, but for the specific individual and for the specific environment that you're doing this in. Next, we move on to modeling. And modeling is showing a person how to perform a skill using a live demonstration. And so a lot of times we hear the generic response of do this. But again, kind of looking at when we're individualizing these prompts, whereas something like do this is an appropriate way to introduce a model prompt, we can also kind of fool around with our language and how we're delivering it to make sure that we're not kind of creating those rote opportunities for learning, and we're also presenting in a way that's age appropriate. And so here's a video example of this.
All eyes on me, 'cause I make it look easy.
I'm now going to demonstrate a model prompt. Watch me. You do it.
Perfect. So pretty simple. But again, I think going back to just taking into consideration, especially as we're looking at these adult learners and trying to work towards integration in with general population, both in educational settings and work settings, is in addition to choosing an appropriate prompt, I really like to promote also trying to use natural language that we kind of get hooked on that SD voice, right? Do this, copy me, hands up. And so, hey, can you come over here and help me do what I'm doing? Or can you take over? Or watch this. Some of that more natural language, I think, can lend to more naturalistic learning opportunities. Okay, and so then we move on to gesture prompts. And so that's using a brief physical motion, such as a point or like a hand presentation, or nodding towards an item to cue an individual towards the correct response.
Now I'm going to demonstrate a gesture prompt.
Okay, and so then from there, and I don't know if you're seeing a pattern here, we're getting a little less intrusive with our prompts as we move through this, right? We started with physical, and then we were in close physical proximity to somebody without having to be hand over hand. And now we're moving on to visuals, right? And this is anything that's going to be presented visually, right? Something they can see that provides some cues on how to do something, or what the expectation of what should be done. So visual prompts, what's important about these is kind of just like everything we're talking about, right? It's not a one size fits all. We want to make sure that the visual prompts we're choosing match a person's comprehension level and their skill level. So if you have a learner that is not able to read, providing a written list is not going to be the most appropriate visual schedule. If you are working with somebody who maybe has some form of cortical vision impairment, right? Or has some vision difficulties or deficits, we might look at larger pictures, or pictures that have color with high contrast in them to make it more easy for them to see. And so these types of prompts can be used for single step or multi-step instructions, right? So whether it's putting a sign on the wall that says the trash is here, or if it's a 3-part sequence on how to rinse your dish before putting it in a dishwasher, these can be modified and adapted to meet the skill need, the teaching need, and the task specifics. And so again, these can include drawings, checklists, written instructions, picture instructions, schedule boards, photographs. I think the laundry list can go on as to how we can do this. And so these are just some examples of visual supports that we see every day. So, where you should stand in line and the space in which you should stand in. We saw this a lot through the pandemic, but even outside of the pandemic, we often see these things like when you're at the pharmacy at Kaiser, right? Or when we go to grocery stores, the lanes are clearly marked off as to which register goes with which lane. Grocery checklists. We've got recycling bins that show compost versus trash versus recycle. Okay, and so now we move on to verbal prompting. And verbal prompting is whenever we're using additional spoken words after the instruction. So this doesn't include the instruction. This is, again, remember the prompt is delivered between instruction and response. And so it's information given verbally between those two things. And it's best for teaching single step instructions, and is often effective when we're looking at functional communication skills. And a lot of times this one is the most used one, but it's always not the most appropriate one. Like, it's easy because we always have our voice with us. But when we say it may not always be the most appropriate, it's because it's not always the least intrusive, even though it may seem like it is. And it's the most difficult to fade, because somebody is relying on a person being present with them, next to them, to provide them the assistance and the information they need, versus something that can be placed in the environment, or other types of prompts and cues that can be established that wouldn't require somebody always being side by side. And so here is an example of where verbal prompts can be used in 2 different tasks. And let's take a look at it and see which one we think a verbal prompt would be more appropriate to use than the other.
Indecisive about the vibe of your wedding? Zazzle is the one-stop shop for every wedding theme.
Please. Please. That was good saying please. Turn on the water. Get your dish wet. Put some soap in it. Good. Now wash it with a towel.
Okay, so let's do a little quick chat poll. So for prompting please and prompting washing dishes with a verbal prompt, which of those two videos do you feel the verbal prompt was most appropriate? All right, good. Please in the chat. Please. Yeah, exactly. So, you know, and this is where we say is there's not always a wrong prompt. There's just more appropriate prompts for certain tasks. So looking at the washing dishes one, right? What do you think are some of the barriers? Like what would make that a less appropriate prompting strategy to support completing that task? Give people a second to ponder that over. Multi-steps, right? You can't fade. We get back into that. Somebody is constantly having to be there for the completion, right? Paula says visuals would be a much better way to prompt that. Absolutely. Yeah. So just looping back, right? Was it wrong? No. Was it most effective? Also no. So just being really, it's when we talk about teaching and planning, right? A lot of times people don't see the amount of effort that educators go into and the lens, because it's not just how do I get through this task in this single moment, but it's what does this task look like in 3 months when I'm no longer here to support the establishment of this of this skill with a learner, right? And so it is thinking through, you know, will they have the same types of stimuli and materials that I have in my classroom in their home setting? And if the answer is no, we've got to modify what we've got in our classrooms to make this more functional outside of the classroom. It's, you know, will they have somebody to verbally prompt them when they leave my classroom, when they leave my educational setting? The answer is no, then we don't want to have them become reliant on a type of prompt that's not going to become made available to them in their natural environments if that's not where we're already teaching this. And so now we're going to do a quick little matchy match. And if you've been paying attention, this should be a breeze for you. So looking at column A and then answers being in column B, which of the options in column B is the correct prompt for a live demonstration of a skill? Cool. Jennifer's got C. Ross says C. Yep, everybody's blown up. Model prompts. That's it. Okay. And which prompt most appropriately matches the definition of making a brief physical motion? All right, we got B, gesture prompts. Nice. Okay, using words, sounds, phrases to give additional information. All right, these are nailing this. E for verbal. Okay, the use of pictures, labels, signs. All right, we've got visual supports. Perfect. And finally, this is going to be a freebie, but I know you guys would have gotten it anyway. Hand over hand assistance is our physical prompts. Okay, so now here's where we get into choosing prompts. I've kind of alluded to this leading up to this, but now we're going to get into some tips and tricks as to things that you should consider when you are choosing which prompt to use. So first and foremost, we always want to individualize our teaching strategies to meet the specific needs of a person. So we want to consider those characteristics of an individual. What is their level of imitation skill, right? Because if they don't have that as established skill in their repertoire, modeling is going to be a difficult prompt to use. What types of prompts have worked before, right? Oftentimes, especially if we're dealing with older learners, whether they're transition age or adults, this is not their first time receiving support in learning new skills and gaining new skills. So we may look at not reinventing the wheel and doing things that have worked with this learner in the past. The other thing we want to look at is what type of skill is required for the task we're trying to teach. So if reading skills require verbal prompts, then physical tasks may require physical prompts, right? And so we also want to consider, is this a single step or is this a multiple step? Do we need to break this down further and teach each of these steps as single skills? It really is diving into that assessment process to determine which prompt is going to guide us to least intrusiveness and most success with teaching. And that brings us down to consider our least intrusive, right? Not all prompts are created equal. There is a hierarchy, and we want to make sure that the one that we're using is not over prompting a person, and that we're not just picking a prompt and holding on to a prompt forever, right? So we want to meet the learner where they're at. So instead of starting and saying, okay, I'm just going to fully physically help you get through this, we would probably want to start at a natural opportunity for independence. And then from there, provide a visual cue, right? And see if that works. And then if that doesn't work, maybe we're going to insert ourselves verbally with that visual cue. And if we're still not getting our response or the level of independence that we're hoping to see from a person, we'll move on to a gestural prompt, right? And so forth until we make our way through the hierarchy. But the important thing is to stop whenever you find success. So if somebody is successful when you get to the gestural prompt section of this hierarchy, you don't need to keep moving through to see how they do with physical prompts and how they do with modeling. We're just going to stop because we found how we can help them in the least intrusive manner possible. I think the other thing to consider with this, and it's kind of, I think it's between the lines on some of the slides, is especially when we're working with older learners, it's not just looking at the environment. It's not just looking at their skill set too. It's also having a conversation with them about their opinions on how they prefer to be taught, how they prefer to be engaged and interacted with, because I may see this as my prompting hierarchy, right? Where I see visual prompts as least restrictive and I see full physical prompts as most restrictive, but somebody else may not perceive this hierarchy in that way. Somebody who maybe has sound sensitivities or has a distaste for, any kind of auditory stimuli, they may not like verbal prompts. That may be more aversive to them to receiving a partial physical prompt from you. And if that is somebody's learning preference, then we definitely want to make sure that we're taking that into consideration. We're not going to bypass that just because this written hierarchy of prompting is presented to us within a teaching model. Okay, so here I know we've seen some video examples of how these prompts progress, but again, here's just a little visual example of that for you. So when we're talking about a verbal, visual, or gestural prompt, it's get your toothbrush. We're pointing to the toothbrush. The toothbrush is there. That's the visual part. We're giving an instruction that they need to go get it. So that would be the combination of 3 prompts in one. For a model prompt, we see 2 people brushing their teeth, and you've got what appears to be the instructor saying, do this, and brushing their teeth. From there, we've got the partial physical, right? So we're not going full hand over hand, and we're not having somebody brush their teeth 100% with us, but we're maybe just kind of pushing the hand up, pointing it towards the mouth, and maybe tapping the elbow to initiate that brushing motion. And then finally, full physical is where we do get that really intrusive learner to teacher opportunity or learner to instructor opportunity, where we do have somebody holding hand over hand. and doing the full range of motion with that learner. Look, another video.
Oh, is your favorite? Let's see. All right, put octopus in. I helped you put octopus in. Put octopus in. Awesome. Okay. Put the octopus in. Cool, you put it in. Cool. All right, put the octopus in. Awesome, you put the octopus in. Cool. Put the octopus in. Oh, you put it in. Awesome. You're doing so well. Put the octopus in. Great, you did it. You
Okay, so that video just kind of gave you quick examples, right, to kind of put into play what we've been talking about up to this point through this presentation of different types of prompting skills. And that video, they were going from most restrictive to least restrictive, likely because it was an example video to show you what each of those things would look like. And so just kind of looping back to, we always want to have that lens of least restrictive, least intrusive when we're looking at teaching strategies. So if we were to be probing that activity with a learner that we were working with, we would probably consider starting at the end and working our way towards the beginning of that video in terms of the hierarchy or how we would start that process to assess what level of prompts would be needed in that activity. And so let's look at these as just another quick little activity to get your brain moving so we don't fall asleep on our Zoom, right? So if you were supporting somebody out in the community, you guys decide to go play basketball, shoot some hoops. Let's say you've got a really good social skills opportunity that with some other maybe teenagers or other students at a community college that are playing. What types of prompts might you use to support teaching basketball in that type of a setting? And also remembering too, right? It's not necessarily there's a right or a wrong to these sorts of things, right? Model prompts, Mark, that would be a really good one. I agree. Modeling social interactions, right? So not just modeling basketball, verbal, physical, maybe a little bit partial passing of the ball. Exactly. Yeah, there isn't necessarily a right or wrong. It's what is most right for that person and in that situation. Peer modeling, right? Pull yourself out of it and see if you can let that natural social opportunity happen more organically. Great. What about cooking? How might we use some prompts or different prompting strategies for cooking a new recipe? Visuals, right? And what's nice about cooking and using a recipe is it kind of already is a little bit of a visual support. That's something that one of those natural ones that we all use. It's not just because a learner needs some assistance in increasing their independence, but we might need to look at how the recipe is delivered to see, is that appropriate? Is there too many words on the page? Is the text too busy? I also love anything with pictures. I feel like I'm more motivated to follow through with my recipe whenever I've got a picture, because I'm like, I know what's coming at the end of this. Cool. Video modeling, right? Placement, having everything out. That's really taking the time to think through how you're teaching and what you're teaching. So you're not having to stop to go find the butter and go find some eggs. Great. I love that. What about making a phone call? Not something that I feel like a lot of people do these days. We all default to text, but how might you support somebody in making a phone call? Visual written steps, model, visual, task analysis. Absolutely. Yep, modeling, visuals for the phone number, video model scripts, yeah, gesture prompts, all of these things. We can get really creative with all of our teaching strategies and how we're prompting to make sure that we're opening a door for independence, but also not opening a door for dependence on the teacher or the instructor in that situation. Perfect. So now we're going to switch gears a little bit. We've kind of given you the foundation of what are prompts, what are the different types of prompts, and Mary's going to dive into how we're going to use these prompts in more detail.
All right, so switching gears, because typically you're not going to use just one of those prompts. You're probably going to need to start with one kind, and it's really kind of a dance where you figure out, okay, are we independent with just that prompt, or do we need to go a little more intrusive, less intrusive? And so we're going to walk through the 3 types of prompting strategies. And I'd like to just give this section a preface too, because I know a lot of you, especially those that are educators, are probably experts with prompting and scaffolded learning. But those of us maybe from the regional center who don't do direct services or maybe provide support to our direct service providers, we want to present this in a really easy, simplistic way so that they can really grasp onto this and be able to use it. So if it seems a little simple, then I apologize, but I will say, even as someone who's been certified in behavior analysis since 2007, I learned a lot going through this content. And what I learned is that graduated guidance is totally different. It's the exact opposite of what I was trained it was 20 years ago. And what I learned to be errorless learning was very different from how a firm presents errorless learning. And all of this content, despite except the videos, is all content from Affirm. So if you were to watch the Affirm module, it's going to be presented in the same type of fashion. So hopefully some of this will be different or new for you as well. Okay, so the first type of prompting strategy is the least to most prompting strategy. In this one, you're going to use 3 different levels. So there's going to be an independent level or a natural cues level, an intermediate level, which is a minimally intrusive prompt. And then you also are going to have what they call a control level, which I hate the word control because we're never trying to control anyone. But what is meant by control level is that most intrusive prompt that's going to guarantee a desired response. So if you know that someone's not going to ask for a break verbally, but you can guarantee that you can pick up someone's hand and put it on a break card to have them ask for a break, then your control level prompt is going to be the physical prompt where you have them touch the break card, for example. What I like about least to most, especially for our older learners, is that you're really allowing someone first to be independent. So you're not going in there with a heavy amount of prompting from the get-go. And then you just move in and provide next levels of prompting as the person shows that they're either not successful or need a higher level of support. I also like least to most because you can use this with both single step or multiple step tasks. So the utility is pretty vast. Now we're going to watch a video. So we're going to watch a video of least to most prompting with turning on water, I believe. And so what I want you to pay attention to is, can you identify what the control prompt was in this video?
Megan, turn on water. Turn on water. Now you.
Hey, did you catch it? What was our control prompt? And I don't think I can see the chat, so someone tell me if there's anything in there.
Model.
Yep. Exactly. Yeah, so you get it. That was the prompt that precipitated the correct response. So now, how are you going to respond depending on whether the person gets it with your prompt, they don't get it, or they just don't respond? So let's walk through each of those scenarios. So let's say the person responds correctly. We're going to offer that reinforcement. Maybe that's praise. Maybe that's giving them something that they enjoy, a break, whatever that was that you've identified to be motivating for that person for that activity. And you're also going to state specifically what they did. Great. Yeah, that is turning on the water. Let's say the learner's response is incorrect. So they do a jumping jack instead of turning on the water. We're going to deliver the next prompt in the hierarchy, and then we're going to continue through the prompting hierarchy until a correct response occurs, and then deliver that reinforcement. So if the model prompt didn't work in that scenario, then maybe we'd move then to whatever would be next intrusive, which in this case would probably be a partial physical or physical prompt. And then let's just say the person doesn't respond at all. Similarly, we're going to just use the next level of prompt in the hierarchy and continue until the correct response does occur. So the idea is that in any case, we're going to end on a positive note. So that's ideal for learning because we don't want learning to be a punishing event or something that the person is less likely to even engage with in the future. Now, the second procedure, which this was the one that tripped me up, I'll be honest, because when I was trained in what graduated guidance was, which this is going to probably date me as an old timer behaviorist, but what I was trained it was kind of that you do it or I help you situation, which is not something we ever even probably want to admit that we used to do, but that was definitely something that happened. Definitely outdated. We don't do that anymore. And in fact, I was wrong. That's not what it is. Graduated guidance is quite the opposite and is actually more similar to what I was taught was errorless learning, which is most to least prompting. So in graduated guidance, and you're typically going to use this for a new skill. So something you know the person's probably not familiar with, like let's say you're teaching someone a new language, or you're teaching someone to do a completely new physical activity, like they've never picked up a basketball before. You might use a more intrusive prompt in the beginning to guarantee that that person is adequately supported. So in most to least prompting, you're going to use that control prompt from the very beginning. Instead of leveling through the hierarchy, you're going to start with a more intrusive prompt, whatever's needed to ensure correct responding. And then as that person develops success, then you fade through that prompting hierarchy and use less and less support. Graduated guidance, you're going to see this most often for those multiple step tasks, usually with some kind of physical component, because you're going to do that dance between the full physical prompting to the partial physical to the gesture. So you're going to have a lot of levels usually, and you're going to be using these different levels for each step of a multiple step task. We do always want to make the point because unfortunately prompt dependence does end up happening for folks when they're prompted too long or they've just gotten used to really intrusive prompting. And as we know, a lot of learners with autism, they can develop routines and rituals very easily. So sometimes just having that same prompt for multiple times can make a person dependent on that for the future response, because they think that's now a part of the chain of, say, toothbrushing, hand washing, dressing. So we want to make sure we really fade our prompts as quickly as possible so that we don't fall into that prompt dependency trap. And you're not done with Amy yet, because she provided us a nice little video to explain prompt dependency in a little bit greater detail and also give us some tips for how we can avoid it from the get-go. So we're going to let Amy share with us what prompt dependency is.
What is prompt dependency?
Prompt dependency is when a person needs a prompt to complete a task that they already know how to do. Now, not all prompts are bad. As you've learned today, prompts can be very helpful in teaching people new skills. However, how we choose to use and fade those prompts over time can impact how independent a person may become with the skills that we're trying to teach. Prompt dependency can present itself in many ways. It may look like a person stopping in the middle of a routine or task that you know they can do independently without really any reason as to why. It may look like a person making fixed eye contact with a support staff, potentially looking for an instruction. Or it could be a person extending their hand or extending an item in the middle of a familiar routine or task, potentially seeking a physical prompt from their support staff. So here's an example. Let's say you're working with an adult who resides in a residential facility, and this person has been known to be independent in washing their hands in all the time that you've been supporting them. But more recently, you've seen that they appear to be getting stuck at the rinsing their hand mark. They're not turning the water off. So you start saying, turn off the water, because you kind of get the feeling that if you didn't say that, they would just keep rinsing their hands all day long. So when you deliver the instruction, the person turns off the water and happily finishes the routine, dries their hand, and moves on. So in this case, we can see that the person has clearly become dependent on you saying, turn off the water, to be able to progress through the known task.
Why does prompt dependency happen?
Ultimately, prompt dependency is a teaching error. As support staff, if we provide prompts with every step of a new task, we start creating barriers for the people we're supporting to learn how to move from one step in a task or routine on to the next without prompts and without independence. Individuals that may have a long learning history of learning new skills through the use of prompts may form habits in waiting for prompts as part of learning new skills and routines. And as support staff or support professionals, we often make errors by maybe prompting before somebody needs help within a task. Maybe we provide a more intrusive prompt than is necessary, or even not fading a prompt out when we start seeing the person we're supporting show independence and success with a task.
How do we avoid prompt dependency?
The best way to address prompt dependency is avoiding it in the first place. You can do this by planning ahead with these 3 tips.
Number 1.
Always make a plan for fading. So often, focus is placed on skill acquisition, but our jobs aren't done once a person we're supporting has mastered a new skill or a new target. The teaching process should continue until you've gotten rid of or faded out the prompts in place. Our goal is to promote independence with the people we're supporting. By planning ahead for the fading process either before or while you're teaching a skill, you're less likely to forget to do this.
Number 2.
Use least to most intrusive prompts when needed. Less intrusive prompts will be easier to fade.
And number 3.
Be patient and give the person a few seconds to respond. What may seem like an insignificant 3 to 5 seconds between delivering an instruction and giving a person an opportunity to display a skill may be the difference between prompt dependency and independence. Try to remember that interrupting with unnecessary help is not helpful.
What if a person is already displaying signs of prompt dependency?
If you're already supporting somebody who's displaying signs of prompt dependency, we'd recommend you contact a behavior analyst or somebody with similar training in order to come up with a plan to fade that dependency. It's important to remember, though, it can be an intense process in fading prompt dependency to independence, so please be patient and give your plan time to work.
Okay. So I really like that we cover prompt dependency in this presentation because, and I don't know, you all are here today, but when we're putting together these kinds of trainings, these kinds of workshops, when you think of prompting, it just kind of sounds pretty basic. And I think the important thing to know is that, yeah, it is kind of a basic idea, just helping someone to learn, but we can really screw things up if we don't do it correctly. And if anyone's ever worked with an individual with severe prompt dependency, it can be a really sad and difficult scenario, not only for that person, but their family, their circle of support, and can really be a long road to getting back to a place where that person can be independent, even with basic self-help skills. I did encounter a man once who was so prompt dependent that he wouldn't even eat food and he was capable, but until someone would touch his hand and put it on his fork, it wasn't until then that he would pick it up and actually take bites of his food. And it was really sad to see someone sitting eagerly looking at their food like, I want to eat that, but I physically cannot until I get help. So it can really be detrimental to a person's life if we don't use prompting correctly. So here we're going to watch, going back to our second procedure, graduated guidance, where we start with that more intrusive prompt and fade it out as the person is successful. We're going to watch a brief video example. I'm going to skip over some of it because it's a little bit long, but this is a video of someone teaching someone else how to write the word friend in Cantonese, which I would probably need full physical assistance initially too.
The best moves you can do to naturally reset your pelvis and your SI joint to relieve.
Write friend in Cantonese. Write friend in Cantonese. Write friend in Cantonese. Write friend in Cantonese. Let's try again. Write friend in Cantonese. Cantonese. Let's try again. Write friend in Cantonese. Write friend in Cantonese. Janelle, you did it. That's amazing.
Okay, so you probably noticed in that video that there was full physical hand over hand assistance provided. And then there were a couple of times where there was some either waiting or providing a little less support physically. There were some errors embedded, and then a more intrusive prompt was provided until the point where the teacher's hand was just kind of shadowing the learner's hand to independence. So that's with one type of skill. Now we'll watch another video showing how graduated guidance can be used across a variety of different skills.
What is it? Spoon. Spoon. What is it? Spoon. What is it? Spoon. Yay! Touch cup. That's the cup. Touch cup. That's the cup. Touch cup. Touch cup. Good. Touch cup.
See me move my dang head.
Match fork. That's matching fork. 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 Match fork. Good. Match fork. Yay! You eat with a fork. Fork. You eat with a fork. Fork. You eat with a fork. You eat with a fork. Do this. Good, that's doing it. Do this. Good. Do this. Good. Do this. Good, yay! Clap your hands. That's clapping your hands. Clap your hands. That's clapping your hands. Clap your hands. That's clapping hands. Clap your hands. Clap your hands. Yay!
Error correction, on the other hand, is a little different. So you use error correction immediately following an incorrect response.
Okay, so we're not going to watch the error correction piece because we're just really interested in seeing what graduated guidance looks like across those different skill sets. So you can see whether it's a verbal type of a skill or a physical type of response. You can start with a more intrusive, full verbal prompt and then go to a partial verbal all the way to independence. So now how are we going to respond based on how your learner responds? So if the learner is successful and completes the steps of that task, either with or without your prompting, you're going to wait until the end. So any multiple step task, we want to wait until the end and it's been completed to provide our praise, our reinforcement, our reward. That's the critical piece. With a no response or a non-response, so the person doesn't initiate the task when the instruction is given, we're going to wait a couple of seconds and then prompt to the person to start the task. And then if it's an incorrect response, so, we mess up and we let the person fully respond and say, match the fork to the spoon, we're going to give corrective feedback in that case. So we're going to let them know that that's not the correct answer, or oops, we missed a step, something like that. And then what we're going to do is go back and repeat the last successful step. So if it's a multiple step task, say like toothbrushing, and the last successful step was turning the water on, but the person didn't rinse their toothbrush or forgot to turn the water off, then we're going to go back to turning the water on and repeat the last successful step. But then now we're going to anticipate that the next step in the chain is going to be where the error is, and we're going to prompt at that step. So we're kind of going back and recreating that sequence of events, but in the correct order. Okay, and then the final one, simultaneous prompting, and this one is what Affirm calls errorless learning, where as I shared before, what I was taught this was actually errorless learning. And you saw that in the video too, that's what they called errorless learning in their video. What Affirm presents to us as errorless learning is actually a little bit different, and it's called simultaneous prompting. In this situation, you do typically only use one type of prompt. So you're using a control prompt at the same time that you give the instruction. So this is a little bit different than what we've talked about before, which is that the sequence of events goes instruction, then prompt, then response. In this case, with simultaneous prompting, you are giving the instruction while you're also prompting. So you do that instructional lesson, and then you move to a probe. So then you back off completely and see if the person gets it correctly on their own. And then if they don't, then we keep going back to that instructional lesson. So you're really either doing a prompt or a no prompt or a no prompt. And so this typically makes more sense when we're doing this with single step responses, like teaching a single word or one type of physical response. And we'll show video. So this is a visual of how that sequence of events is going to play out. In your instructional lesson, you give that instruction along with your control prompt at the same time. You will achieve a prompted correct response if your control prompt is doing its job, and then you offer the reward, praise, whatever that may be. And then in the probe lesson sequence, you give your instruction, but no prompt. So either the learner is going to respond correctly or incorrectly. And if the response is correct, likewise, we reward. If the response is incorrect, we pretty much just ignore it. And then we go back to that instructional lesson sequence. So here's an example of how that might look with teaching someone to put their mask on, which all these mask videos seem pretty irrelevant now. So I think we need new videos, but at the time it made sense.
Put your mask on. There we go. Perfect. Your turn. Put your mask on. Put your mask on. And put your mask on. Good job putting your mask on.
Okay, so hopefully that was pretty clear. We saw Erin grabbing Emily's hand, saying, put your mask on, and prompt her while she was giving her that instruction. And then she did the probe and just said, put your mask on with no prompt. Emily didn't respond to that. Erin ignored that, went back to the instruction, and then the final probe was successful. Okay, so now I'm going to have you enter in the chat, which do you think is being used in this scenario? So care home staff are working with Tanya on washing her hands after she uses the restroom. Today, staff decide to wait outside the restroom and see if Tanya washes her hands on her own. If she doesn't, then staff gesture toward the faucet. If she doesn't respond to the gesture, staff gently guide her to the sink. So what do you think? Is this an example of least to most, graduated guidance, or simultaneous prompting?
Least to most popping up in the chat.
It's a smart group. I mean, I knew you guys were smart, but these activities are way too basic for you all. Yes, exactly. So that least to most approach, where we're allowing for independence to begin with, and then using that intermediate level, and then the control prompt. Yeah. Okay. So now we're going to get into how do we determine which procedure we're going to use. So just how Amy presented us with some ideas that guide us in which type of prompt we might use based on the person's characteristics and preferences, as well as what the skill is. We also have to take a couple of things into consideration when we're figuring out which of these three procedures we're going to use. So the two primary factors that you're going to take into consideration are the type of skill, so whether it's a single step skill or multiple step skill, as well as how proficient the person is with it. So if it's a completely new skill, you're going to likely pick something different than if it's not new to the person, but maybe they're not very proficient or consistent with using or demonstrating the skill. And here's a visual decision tree, if you will, to help determine which of these 3 strategies are going to be most effective. So if the skill is a single step skill, for example, and it's new, then that simultaneous prompting, like we just saw with the teaching to put the mask on, that's probably going to be a pretty useful strategy for you. If it's a single step skill and it's not a new skill, but maybe the person uses it inconsistently, we might use least to most, as well as if the person just is no longer able to use the skill, we might use least to most. If it's a multiple step skill, and it's a skill that's embedded in your everyday routines, things like toothbrushing, getting dressed, then we might use something like that graduated guidance procedure. However, if it's something that the person was previously proficient with, we might also use least to most prompting. Now, here's a video from one of our community crisis homes for adults administrators. So this is an administrator for one of our adult homes. And I really liked his perspective on what he takes into consideration when he's selecting prompts for our older folks. And so we'll watch his perspective here.
Hi, my name is Shoa from Kala House CCH in Orangevale, and some of the barriers to prompting that I found with the adult crowd is that a lot of the materials and trainings are geared towards children, which makes it so that our way that we prompt is more so geared towards children. I find that it leads to more prompt dependency. We might be quicker to jump in and do a full physical prompt or a verbal, which are really hard to fade, and a lot of times it hinders the sense of independence that our residents feel. And I find that it's really difficult to know how to prompt when honoring rights and not limiting movement and really being in tune with if a resident resists your prompt, when to discontinue the prompt and find a different way. And I found that you have to be really innovative with the prompts that you do use. You have to use more gestural prompts, positional prompts, ways to avoid using those verbal prompts, which are hard to fade. Visual prompts, we use token boards or picture icons to mark where to put something within the home. We have to make sure that those are in common areas that have heavy traffic so the residents can always see them and we don't have to, routinely bring it to them. Which also kind of lends to the fact that when prompting with adults, we have to be more natural, as we're used to more so giving directives to children, but we're dealing with, peers in a sense. And we don't give directions to peers. We have to make things natural. Instead of saying, go get dressed, we might say, hey, I think you should go get dressed really quick because we're about to make dinner. What do you think? And you offer it as a suggestion rather, and it's more collaborative. So all in all, we deal with making things more individualized and less restrictive when prompting, which can make it all around a lot harder for us.
I think my favorite part of that video is where he makes the point that it's common to give directives to children, especially if you are an educator or you're a person in a teaching type of position. But if we're thinking of the people that we're supporting, these adults as peers, then yeah, that's really not something we would do with our peers necessarily, unless you're the bossy friend, which I can relate to that. But I would say, I really like that point that the prompts with adults are going to be more the suggestions and more the collaborative approach. Okay, so now we're going to do a little activity using that decision tree. So we'll go back to that and take a look. But I want you to decide which prompting procedure to use based on this scenario. So up until 3 months ago, Jared would wake up every morning and brush his teeth on his own. But now Jared rarely brushes his teeth, needing frequent reminders to do so from staff. And I will give the caveat that we are going to assume that there's no medical reason for this. There is no dental problem, let's say. He's just not really brushing his teeth anymore. So based on our decision tree, which would you think would make the most sense? Least to most. I can't stump you guys, I don't think. Okay, yeah, least to most, right? So they're more inconsistent, they're not able to use it, it's not a new skill. So based on this decision tree, that's what we would suggest as well, is using that least to most, where we're just kind of jumping in and giving a little bit of support, maybe increasing our support as needed. Great. Okay. So as with anything, and this is likely not familiar to any of you as Captain Cadre, who are very familiar with the Affirm modules, as well as the data collection forms and the checklists and the prompting, the tip sheets for professionals. But we did craft this presentation with our adult service providers in mind. And so we do share with them that if we're going to make sure that beyond this session today, that we are using these strategies correctly, there are these guides that exist and we can access them on the Affirm website. So the prompting implementation checklist is going to ensure that we're using these prompting procedures with fidelity. And then also we want to encourage data collection, because we know that this is our best way that we can determine if what we're doing is even working for an individual or even for a group. So depending on the type of procedure, we might be more interested in collecting data on different components. Ooh, and I think Anne put something in the chat. Thank you. Okay, so with least to most, we're most interested in how the person is responding to our prompts. So are our intermediate prompts working? Are the more control prompts working? Where is that person falling as far as the intrusiveness of prompts that are needed to get to the correct response? With graduated guidance, since we're usually going to use this with a multiple step instruction or task, we want to be looking at how many steps of the full task the person is gaining independence with. So that way we can measure progress by determining if the number of steps that the person is gaining independence with is increasing or not. And then with simultaneous prompting, because we're really just using that one single prompt and the reward, we want to see if that prompt is getting us that correct responding or not. And then we also have to figure out the how, not just what are we collecting data on, but how and when are we going to be collecting this data? So we're going to have to figure out who's responsible. Is it going to be the administrator? Is it going to be the staff every day? Is it going to be the behaviorist that comes in once a week? Is it going to be a teacher? Who's going to collect the data? And then also, what symbols are we going to use to indicate success and the types of prompts? So we may use a big P for a full physical prompt and a little p for a partial physical. We might use a VIS for visual. So we have to figure all these things out and then share that with the team so that everyone can be consistent with how we're collecting that information. Or maybe we're going to go simple and just do a plus minus kind of a situation. And then, of course, as you all know, we have these pre-made data collection forms available on the Affirm module for prompting. Here's an example of what the least to most for a single step instruction might look like. So in this case, our target is, or our goal, our task is going to be put your mask on. And then you're going to indicate different levels of prompts and then which one the person was successful with. So let's say level 1 is independent, level 2 is going to be your intermediate prompt, so maybe a gesture, and then level 3 is a model or physical prompt. Then in this case, what this data is telling us is that for our first trial, this person needed a level 3 prompt to be successful. And then there's also a least to most data sheet for multiple step instructions. And then for data on graduated guidance, this is going to look a little bit different because this is going to be for steps of your chain. So kind of like a task analysis, you're going to indicate the time and the date and then the level of prompting that was needed for each of the steps. So instead of going across, your data for this is going to be vertical. And then for simultaneous prompting, this is also going to look a little bit different. We're going to indicate our trials and then what our instruction is or what our goal is, and then whether that was a correct or an error or a non-response. So in this one, it's going to be horizontal again. Okay. Okay, so let's do a little bit of practice. So we're going to go back to that simultaneous prompting and we're going to watch the video clip again and then see how that would transpire onto a data collection form.
Put your mask on. There we go. Perfect. Your turn. Put your mask on. Put your mask on. And put your mask on. Good job putting your mask on.
Okay, so we had a total of 4 trials. Our first one was the instructional because we had our prompt included and it was correct because if the task was completed, even if it was prompted in this case, we put our X in correct. The probe, the second trial was a probe trial and there was no response. Our third trial was an instructional trial and that was correct. And then our final probe was also correct. So that's how your data might look for that type of situation. And then I love that Affirm, I took this from Affirm. I love that they always have this troubleshooting slide because as we know, we are not accounting for all of the barriers and difficulties that may come up in the experience of trying to assist someone in learning a new skill. For example, you know, all of our learners we saw were very active, engaged participants in all these videos to just make it very clear the procedures we're using and the types of prompts we're using. But we're not accounting for the person that's going to throw the puzzle piece, you know, instead of put the puzzle piece in, for example. So whenever we're dealing with issues, barriers to progress, we want to ask these different questions to ourselves and to our team. So is the target skill or behavior well defined? Is it clear what we're working on? Is it measurable? Is it observable? Or are we asking someone to collect data on someone's level of frustration when that's a subjective experience? And internal, is the skill too difficult or does it need to be broken down into smaller steps? This was one that I worked directly with one of our care home providers on when we were trying to help someone do laundry independently. We had to change our visuals because putting all of the steps on one page we learned was too much. So we had to do one picture per page, for example, and do kind of a flip chart. So that's it. Not only is the skill too difficult, but are your materials too difficult to understand also? And has enough time been devoted to the strategy? We don't want to just disbandon something because maybe it hasn't worked for the first couple of times. Maybe we do want to troubleshoot and change things up in how we do it before we just decide it's not effective. And then was prompting used with fidelity? So did we use the prompting implementation checklist? Did we use graduated guidance in the correct form? And is the selected prompting procedure appropriate for addressing the target skill or behavior? Or are we using something that's maybe not going to yield the best results? And then I think this is always a big one. Are we using adequate motivators? Are there reinforcers in place that are actually something that the person is interested in? If we're relying on praise alone, that may not get us to the finish line. And is the response interval an appropriate length? So are we expecting someone to complete a task that's a lot longer or above really their tolerance level for doing a task like that? And then are teachers and practitioners responding to the person's attempts appropriately? Are we even giving positive or corrective feedback to the learner as they're engaging in the learning task? So these are all things that we can explore when we do run across those issues. Okay, so at the end, we always want to have you all think about how to take this forward for you. What does this mean for you? And all of you are in different positions, working for different kinds of agencies, so it might look a little bit different. And you don't have to write it down, but I would say if we can just kind of go through and maybe just share in the chat one thing that you remember, or a takeaway, I guess I would say, that you're going to take away from this training today.
That in the chat. Think of adult learners as peers.
Yeah, me
like
too.
that.
I took that away too, Michelle.
With older students, prompting looks more like suggesting versus telling. Absolutely.
Yeah. Yes, prompt dependence is a teaching error. Yeah. Carefully plan the prompt. Yes, love that. Always take into account autonomy and learning. Yes, we are into that stage and phase, which I think is really positive, where that assent-based kind of support, where we're getting permission, and we're making sure that people are along that learning journey with us, and not kind of forcing ourselves on people. Okay. And then what is one thing that you think you can start tomorrow, or one way that you might change your approach to prompting? Use suggestions. Sure. Plan for fading. Oh yeah. When we did this, make sure going from least to most. Yeah, that's a good one. I think use a firm data collection tool. Totally. They're already pre-made, right? Just download them. They're good to go. When we gave this training to our service providers on Tuesday, it was a lot of people from care homes, a lot of people from supported living agencies, which are people that are paid support in a person's own apartment or home. And a lot of them said, we are going to go take this training and give it to our staff. So that was really positive. Make it more natural. Sure. Awesome. Well, thank you all for participating with us today, and also for sharing some with us to make it a little bit more interactive in our chat. We always appreciate that. And please do, as Anne suggested, please do take a moment to do our satisfaction survey. That really helps us so that we know if we're on target, or also give us suggestions for ways that we can do this better. Because I think even though we've been doing virtual so long, we're still always learning. So yeah.
Thank you, Mary and Amy. You guys are amazing. Let's give them a round of applause. We have 4 minutes for questions. So if you want to come off mute and ask a question, and while we're doing that, I will let you know that I'm going to take the PowerPoint and the recording and have it posted on the Captain website right next to the one they did last year on this exact same date, except that one was about visual supports. And so they're amazing presenters. So this is just such good information. And Mary and Amy, somebody actually wrote in the chat to me, and they go, We're actually doing a training scheduled in a couple of weeks for our adult providers, and this is perfect
Yay.
time.
You can steal some of our examples.
That's actually what I was going to ask. Do you have links or something that you could share of your little video examples?
So the links are actually embedded in the
Oh,
training.
okay.
Yeah,
Great.
so you can just click on them.
Great, thank you.
Yep, all of you through the data system, if you look on that page where the Zoom link was, it says resources, and that PowerPoint is there for you. And if you can't find it, I know one person told me I'm going to be sending them the PowerPoint as a PDF. So,
And yeah, it's not easy to find videos of adults doing adult things. I mean,
Well, not just adults doing adult things, but then the learning facilitators doing it right too, right? It's that not only are the adults doing it, but are they teaching correctly?
yeah, and I could be nitpicky about some of the videos we actually did use.